Hey everybody, it's Nick with the MP2C. Today is the 15th of April, 2020. This is the situational report from the World Health Organization. As always, all of our information comes from the World Health Organization. There are links to their situational reports down below. I have found that those reports very closely mirror what the CDC and other organizations are putting out as far as coronavirus statistics. So this video is going to be a little bit of a longer one. I don't know how many of you are dealing with wrangling kids throughout the day and trying to get work done during this whole process, but for me, the last week, it's not been particularly fantastic. So, 3 days worth of content. There's some information for Pennsylvania from Governor Wolf, some information for Governor Hogan, and let's just jump into it. So, this information starting off for the 13th, again, the World Health Organization categorizes the United States as solely the North American landmass. It does not include territories, but those territories' statistics are included below the United States when you look at the graph or the information that they present. We're also going to include highlights from the World Health Organization. They put little comment blurbs in every SitRep. Don't touch your face. Let's just jump into it. On the 13th, there were 524,514 total confirmed cases of COVID-19 in the United States. 31,633 of those were new. 20,444 total confirmed deaths since reporting began, and 1,928 of those deaths were new as of the 13th. It brings the case fatality rate to 3.8%. If you are not familiar how we get that case fatality statistic, in our last situational report video, there was an excellent link, reference to Encyclopedia Britannica. They kind of spell out how to get that, but essentially it is the total deaths divided by the total cases and multiply that by 100 for a percentage. For the highlight from the World Health Organization, there's no evidence that the, I'm gonna butcher this, Bacille Calmette-Guerin vaccine, BCG. So there's no evidence that the BCG vaccine protects people against infection with the COVID-19 virus. There are two clinical trials addressing this issue, I guess, and the World Health Organization will evaluate the evidence when it is available. In the absence of evidence, the World Health Organization does not recommend that that vaccine is used for prevention of COVID-19. They have a link in that SitRep, which again is down in the description. You can go check it out if you would like. As of the 14th, there were 553,822 total confirmed cases. 29,308 of those are new. There are 21,972 total deaths, and 1,528 of those were new. Brings the case fatality rate for the 14th to 3.9%. And the highlight from the World Health Organization is that the number of confirmed cases reported by countries reflect national laboratory testing capacity and strategy. Thus, the interpretation of the number of cases reported should take this into account. So that's something that we talk about in the fact-checking video, in the bias video, in kind of a roundabout way. I know I've mentioned it in several other SitRep videos and other videos that we've put out, but basically you got to kind of read between the lines and make some assumptions when you're doing analysis on data. Looking at capabilities and reporting metrics and how that information is presented, kind of the word salad that is presented with the information. So you got to read between the lines on what they may mean, whether they're using a certain phrase to, illustrate that maybe they're not sure, or they're erring on the side of caution or something like that. So that's a good point that the World Health Organization puts out in regards to national reporting or testing or any of that kind of information when you're doing data analysis, right? On the 15th, there were 578,268 total confirmed cases. 24,446 of those were new. There were 23,476 total deaths, and 1,504 of those are new, resulting in a 4.0 case fatality rate. So I'd like to point out over the last 6 days that case fatality rate has sort of been creeping up, at least in my local area, as I drive around if I have to get groceries or get gas or something like that. I'm not seeing a ton of people abide by social distancing recommendations, not abiding by the use of face masks. really it doesn't seem as though things are being taken seriously. I've seen a couple of grocery stores that aren't like at least visibly to somebody who's observing. They're not, sanitizing their carts, things like that. So there are things that we could be doing better. When you confirm it to the global rate, there are 1,914,916 confirmed cases as of the 15th, resulting in 123,010 deaths with a case fatality rate of 6.42%. So we're doing better than the global scale. We can compare to various countries and form our own opinions on that. But globally, we're below that case fatality rate that everyone is experiencing. It's still not a great picture, to be completely honest, and I personally believe that after looking at the data, that 6.42% is a low number. I feel like it's probably much higher than that, especially with countries that don't have the ability to test, don't have the ability to report, countries that may censor the data that they submit, stuff like that. The highlight from the 15th is there's no evidence that oral poliovirus vaccine protects people against COVID-19 virus. Clinical trial is planned in the United States, and the World Health Organization will evaluate the evidence when it is available. Again, greater details are available on that situational report. Additionally, the World Health Organization has published an updated strategy, preparedness and response plan to defeat COVID-19. The document takes what we've learned so far about the virus and translates that knowledge into strategic action. More details can be found in the link in that SIT report. It's a very lengthy document. I don't think that there is enough time in a quick picture video like this to go through it. If it's something that you would like to dissect and go over, please submit a comment, and I will most certainly look into that and give you my thoughts and analysis on that. As for news for Pennsylvania, as of today, the 15th, Governor Wolf has announced, and Governor Hogan announced a similar measure. But again, see the link down below. It's a lot of information for the amount of time that we have, but the Cliff Notes version is that most customers will be required to wear masks while on the premises of all businesses that serve the public within a building or defined area. Additionally, employees must wear masks, and they must be provided to the employees from the employer. Employees' temperatures must be taken before the start of their shift. They're encouraged to stagger when shifts start, prevent congregations of employees or people. And if that temperature is higher than 100.4 degrees, the employee must be sent home, cannot come back to work until they're 24 hours without a fever, etc. Again, there's a litany of other requirements. The description has the link below. Go check it out. It's good information, just way too much information for the time we have here. A couple days ago, Governor Wolf announced, again in conjunction with Governor Hogan and I believe 5 other states, a multi-state council to get people back to work. A ton of information. Link is in the description down below. I have my own thoughts on that. I understand the need to get the economy rolling, get people back to work, both on a personal level and when it comes to state and federal government. I don't think we're at that point yet. Read the document, form your own opinions. Feel free to have a discussion with it. You can always message us at EMP2C on Facebook. These videos go on YouTube as well. You can check it out there. We'd love to know your thoughts, hear your thoughts. Coming up for us, there is a video for ibuprofen use during the COVID-19 epidemic, whether it's recommended or not. That video was requested by a viewer. And then we have psychological effects of disasters. I'm still trying to nail down a mental health professional for their opinion on that. And then misinformation media campaigns I've been mentioning last week or so now. But those videos, you should get one every week going forward, released on Fridays, I believe. As always, don't touch your face, wash your hands religiously, sanitize doorknobs, steering wheels, shopping carts, whatever. Watch out for your neighbors. If you haven't heard from somebody in a while, send them a message on Facebook, send them a text, call them, check up on them, make sure they're doing okay. Help out everybody. Everybody's in the same boat, going through the same thing. The disasters begin and end in the local community, and that's where the effects are felt most. So let's do our best, do our due diligence, check up on people, be supportive, do what we can for our neighbors, right? Thank you for listening to me. If you have any comments, questions, as always, leave them down below. Check out the links in the description, and have a great night.